covering the community, events, and people of Georgia, Carolina. This is the Means Report. Here is Brad Means.
Hello, everybody, and welcome to the Means Report. So happy to have you with us. I know that you have a big day of football planned as you get set for the AFC and NFC playoffs later. But before you get in that football mode, you have to get in the Means Report mode and watch this edition because we do have some great information over the next 30 minutes for you, beginning with some great information for people who are battling cancer or people who love people who are fighting the fight. There's a wonderful program that is getting ready to get started at Doctors Hospital in conjunction with the American Cancer Society to help you feel good about yourself and look good. And it's something that so many people can take part in, and it's just wonderful, I think, that Doctors is doing this. And so we have them today to talk about that and to explain how you can take part in these upcoming events. A little bit later, Augusta Mayor Deke Copenhaver recently gave his first State of the City address, kind of sizing things up for the Garden City and letting everybody know where we stand as we enter 2012 and really what to expect for the remaining 3 years of his term. And the mayor is going to be here in just a few minutes, as he is every quarter on the Means Report, to break down what's going on in and around Augusta. And he's pretty excited about the events that are happening in his town too. But first, let's talk cancer. You know, we've never shied away from health issues here on the Means Report. We've also never shied away from reaching out to our friends at Doctors Hospital, like Lance Danko, who is the head of oncology services at Doctors. He is back on the set of the Means Report. He's a veteran of the old set of the Means Report. Lance, you're back on the new set. Welcome.
Thank you. It's great to be here, Brad.
Well, it's great to have you. Danielle Truan with the American Cancer Society, thank you for being here.
Thank you for having us.
Well, I appreciate it. And I'll start with you because you brought a prop, and we love props. We're here to talk about Look Good, Feel Better. It's a series of events that's taking place in the next few months, really for the balance of the year, starting in February, to help cancer patients. And when I say help, Danielle, we're talking about cosmetically, to give these ladies help with the way they look, especially in the wake of cancer treatments. Kind of tell me, first of all, what is in your prop bag and why the American Cancer Society is playing a role in this.
Sure, thank you. I do want to say that Look Good, Feel Better is a free national public service program designed to help women deal with the effects of cancer treatment related to appearance and other issues that they may experience. And so it's actually a collaboration between the American Cancer Society, the Personal Care Products Council Foundation, the Professional Beauty Association, and the National Cosmetology Association. So it is a group effort. And certainly we're excited about partnering with Doctors Hospital for this new class offered in February. The class is a workshop hosted by a licensed cosmetologist who goes through a volunteer training. So it's a 2-hour session. They cover different makeup issues that you may have to have experience with, and then hair, skin, and nails. And so they do get this kit when they come to the class, and they can get in their skin tone of light, medium, dark, or extra dark. The kits are valued at approximately $300, and all of the items are donated in the product. In the bag.
So you're talking about makeup in there that they can use right away?
They sure can.
All of it donated?
All of it's donated. And all the products, and we mentioned this earlier, are true size makeup products, so they're not travel size. And the women can take them home with them and use it for their everyday needs.
Lance, why do this? We do appreciate the fact that it is a national effort. We do know that Doctors will be better than all the other places in the rest of the country that are doing it. It will be best here, we know that. But why take part in this, and why go the extra mile, so to speak, instead of just dealing with the typical clinical side that we usually associate with hospitals?
Well, Doctors, we strive to really take care of the whole person, and that whole person really represents, body, mind, and spirit. And when a person looks good, they feel good. And this is a perfect opportunity to have ladies come together for fellowship, to work with one another, to learn some new techniques and some ways to take care of themselves so that they feel better. And so we're honored to have this program.
Well, let me first of all ask about the makeup side of things. A lot of people associate hair loss with chemotherapy and radiation treatments. But there are also skin issues that can arise. Can either one of you speak to those and what kind of skin needs a woman might have in the wake of cancer treatment?
Sure, absolutely. Some women may experience some dryness on their face during their cancer treatment. You also have eyebrows, and so when you may lose hair on your head during chemotherapy, you may lose your eyebrows and eyelashes as well. And so for a woman, we know a lot of your esteem comes from you know, the way you look. Sure. And in your everyday, and so the makeup, anywhere from the eyeliner techniques to the mascara techniques, helps these women combat some of those issues.
This isn't just a one and done thing though. It kicks off February 6th, but you're going to be sticking with it throughout the year. Tell me a little bit about that and why you decided to offer so many workshops. We have the dates posted on the television screen, Lance. It's a year-long deal.
What we try to do, it's a one workshop deal for each lady. Each person will get the makeup bag, but we can only accommodate up to about 10 or 12 people with each workshop. So that's why we'll continue to have it throughout the year. Well,
so you're talking about, Danielle, really individualized attention here. If you're able to get into one of these workshops, you'll walk away really having a feel for how to apply the makeup and how to deal with your appearance, correct?
That's correct, yes.
Tell me about the wig application part of it as well, because as I mentioned a moment ago, that is the most noticeable in many cases. And how can you help with wigs? Will there be wigs for sale? How's that going to work?
Sure. The facilitators for the classes will bring wigs to show examples to the women of how maybe they can use a turban or a different hair dressing on the wig to help them apply it, wash it, those sorts of things. I do want to say that the American Cancer Society office locally has a patient room where women can come and receive a free wig when they're going through their cancer treatment. We're really excited to offer that opportunity, and so while the wigs are not available during this session, they certainly can come to our office Monday through Friday, 8 to 5 to receive a wig.
What's the best way to get in line for one of these workshops? I know people are going to be watching this program and I know they're going to fill up fast.
Okay. The best thing to do is, as soon as you know you want to attend, the first workshop does kick off on February the 6th from 3 to 5. We would like for people to call the number at 706-651-4343 to reserve your spot.
Are all of the events going to be at Doctors?
Yes.
How long do they last, each one?
Generally about an hour and a half.
Have you seen, either one of you, and I'm sure you have, firsthand the kind of difference in self-esteem appearance can make, and how, as we were talking before the broadcast, just something very little can provide such a big boost? Tell me success stories you've witnessed, either one of you. Danielle?
Sure, I'd be happy to. I will say we have some other locations also in the community.
Right.
And one of the locations is at our office, and I have the fortunate opportunity to sit in on some of those sessions, and you see the women come in. Sometimes they're down. Maybe they just came back from a chemotherapy session or radiation session, and they're a little down. And I've had patients before say they didn't even feel like coming, but maybe their husband or friend convinced them to come that night. And it's incredible to me to watch 2 hours later when they leave, shoulders up, head back, excited. They've got their makeup on, they're ready possibly to go on a date with their spouse or out with a group of friends. So it's amazing what it does for their self-esteem.
That's something a doctor can't provide in a lot of cases, isn't it, Lance?
Exactly.
Even though you all have great ones over there, it's kind of a special feeling to see them get this kind of boost too.
Absolutely. A little bit of pampering goes a long way.
Well, I know that people can also access information on the web, and we have that information available for you, how to find out about the Look Good, Feel Better workshops that Doctors Hospital and the American Cancer Society are teaming up to put on. So be sure to check the Means Report website if you don't get the information today. And I do know that at 10 to 12 people per workshop, these will fill up and they'll be very popular. And thank you all for doing this. On behalf of the cancer survivors out there and the people who are fighting the fight, I know they appreciate it.
Thank you very much. We're excited to offer this opportunity.
Yeah, it's going to be awesome. Anything else going on at Doctors that I missed or that you want to squeeze in? Anything on the radar?
No, we have a number of events coming up this year. We just rolled out the calendar. We're going to have some different offerings this year, so we'll have to keep you posted on that.
Well, you know we're not scared to invite you back, so I was just sort of getting you set for your next appearance. Just when you want to talk about the next event, call us and you'll be back because you're a great guest, Lance, and we appreciate you.
Sounds
y'all.
great.
Thank you very much.
All right, thank you all very much, and be sure to take part and look good, feel better at Doctors Hospital starting next month and continuing through the end of the year. When the Means Report continues, Mayor Deke Copenhaver with an update on his State of the City speech that he just gave mere moments ago as he looks ahead to 2012 and beyond. When the Means Report continues.